Hey everyone, welcome back. Today we are joined with Dr. Michael Lebowitz, who is calling us from Maui, Hawaii. So we can all be jealous of him. Thanks for joining me today, Dr. Lebowitz.
Thank you for having me.
Of course. So today the topic of discussion is going to be on dysbiosis, heavy metals, and how those relate to neurological disorders, which is going to be a fascinating topic that especially the heavy metals we have not discussed yet on this podcast. So it's going to be a treat for our listeners to be educated by you today. And before we get started, can you tell us a little bit about who you are and why you were so interested in this topic in particular?
Okay, well, I've been a chiropractor since 1980, and I've been teaching other physicians since 1987 about dysbiosis and food sensitivities and toxic metals and the effect of chemicals and electromagnetic radiation and biofilms and mycotoxins, and it's kind of a whole approach that we utilize to lower people's total load so that their bodies can just function optimally.
Mm-hmm. Okay, that's great. And how do you typically approach patients in your office? What does that look like?
Well, I am a researcher in applied kinesiology.
Mm-hmm.
And so we're checking for neurologic sensitivities in people.
Mm-hmm.
And we check them for all different types of microbes, fungi, parasites, spirochetes, viruses, bacteria. We check to see the effect of different, what we call food toxins. Does a person have a negative neurologic effect to gliadin or to alpha-solanine in the nightshade family, or albumin in eggs, or casein in dairy, or caffeine in various things. So we check those type of things. We see if the person has a hypercoagulation problem, because a lot of times if you have toxic metals, if you have different microbes, your blood will get basically too thick and it'll impede absorption. It could lead to some pretty severe things. We check them for about 24 different toxic metals, the ones we find most prevalent, certain toxic chemicals. We check hormone levels. And then we just gather all the information and we look at it. And with some more testing, we devise a treatment plan.
Okay. And with that testing, is it a combination? You said you do applied kinesiology, so is it a mixture of muscle testing plus laboratory testing?
The muscle testing is a type that I've developed, some by myself, some with some physicians like Walter Schmidt and some others over the years. In muscle testing, there's always some false positives and false negatives. Mm-hmm. So over the years, we've developed different procedures to try to minimize those. In terms of labs, we do labs when it seems appropriate. There's a difference between muscle testing and labs that I think is very important. I think, especially say you're testing for a microbe, mm-hmm. A lab will tell you the presence of something. Muscle testing will tell you more if the person's sensitive to it. So there could be two people with the same level of mercury or with a parasite like blastocystis hominis. One person's going to be totally asymptomatic, another person could be disabled. So mm-hmm. That's why we think sensitivity is very important for treatment protocols, even more so than just presence.
Mm-hmm. Okay. And when you find the presence of maybe a heavy metal or gut bacteria or dysbiosis, maybe this is getting ahead of myself, but then what are some of the treatment approaches that you might implement?
I mean, we do some structural manipulation, but most of the time we rely on herbs and dietary changes. Mm-hmm. we've been shying away over the years from using a lot of vitamins and minerals as much as we're using herbs, just because having worked in the vitamin industry for 35 years, the raw materials these days for vitamins are often derived from GMO bacteria and fungi made in factories overseas and then refined down. And to me, it's not the ideal way to treat. It's a little more pharmacological, even though it's labeled under natural.
Right, right. That's a good point. With the I want to get into the heavy metals a little more specifically now, if that's okay with you.
Sure.
So with heavy metals, can we first define what that exactly means, and then maybe some common sources of toxicity?
Yeah, I mean, maybe heavy metals is the wrong term, but metals that can have a deleterious effect on the body. I mean, definitely the most common ones, might be mercury, it
Mhm.
might be lead, it might be arsenic, cadmium. Though these days, because of all the rare earth metals that they're mining so we can have our cell phones and other things, you'll find beryllium, you'll find gadolinium, aluminum, is very ubiquitous in the environment. And in terms of how people get them, excuse me, let me just get some water. Will vary. So, where people get exposed, will definitely vary depending on the metal. I mean, like living in Hawaii here, we have active volcanoes. And according to measurements, the amount of mercury given by the volcanoes in Hawaii is more than is given off by all the coal burning power plants in the US. So we can get it that way. We could get it from fish. We can get it from forest fires, a lot of things above and beyond amalgams.
Mm-hmm.
Lead's in the environment from, many decades and even centuries ago, and it doesn't leave. And it could be found, it could be picked up by plants. It could be found in our food.
Mm-hmm.
They use arsenic as a pesticide. So if you have orchards that are very old, copper is a very common metal that can be therapeutic or toxic, but it's very easy to overload. People use copper in their hot tubs as an algicide. Copper pipes, a lot of quote natural cosmetics that have a blue color or an orange color can be due to copper. They use copper sulfate on organic grape crops because it's an algicide and a fungicide. So, we're pretty much everybody's exposed.
Mm-hmm.
Some people are great excretors, and it might be due to the genetics, it might be due to exercise, it might be due to how easy they sweat. In some people, it tends to sequester in the body, and depending on which metal it is, some of them deposit more in the brain than others. Some of them deposit more in other organs. So the symptoms can be about anything.
Mm-hmm. Which brings me to my next question. What might tip somebody off that they do have toxic load of various metal?
Well, as a generalization, weird neurological things that don't resolve with normal treatment. Like if you have numbness or tingling that doesn't resolve with good structural work or basic nutritional work, or if you have a sense of numbness that's not true numbness, and it might not follow a nerve distribution, it might follow multiple nerve distributions. There's a rhomboid test where if you stand up on one foot and then you close your eyes and you fall over, that correlates pretty well with having a metal load. With mercury, it might be that they drool at night.
Mm-hmm.
It might be that some days their vision's a lot better than other days. It might be that they have unprovoked outbursts of anger. Again, each one's going to vary. With copper, I've seen people just get very stiff,
Mm-hmm.
where they can barely bend down and touch their knees. In some people, it lowers their zinc levels, so maybe they're more prone to getting colds or flus or or even food sensitivities. Again, it depends on what metal and what are the antagonists of the metal. So if you look at the periodic table, for instance, you have zinc and you have cadmium under it and you have mercury under it. And so actually zinc can help chelate out mercury. It's not our favorite thing, but it can work to some degree. Cadmium can chelate out mercury, but you would never give cadmium to chelate out mercury because cadmium is toxic in and of itself.
So it sounds like some of these metals are competing with certain minerals that we need in our body, and you can use zinc, something that is necessary, to potentially outcompete one of those negative metals. Is that right? Maybe not the best way to do it, but
exactly. And what some people don't realize is, there can be toxic metals in your supplements. Like zeolite, which is used as a metal chelator, is actually aluminum silicate. So you are ingesting aluminum. A lot of the fulvic acid and humic acid products on the market, if you get an elemental analysis of them, they have many toxic metals in them. And also the ones that are sold as trace minerals, and they say they have 80 different elements. I mean, if you read that list of elements, there's a lot of those that wouldn't be advantageous to be ingesting on a daily basis.
And then you mentioned chelating with zinc. What chelation seems to be one of the main treatment approaches for heavy metal burden or toxic metal burden. Is that something that you utilize in your practice? And if so, how do you go about doing that?
If we're dealing with toxic metals, there's a number of things that we might utilize. If you're going a pharmaceutical route, which we can't in the office, you might use something like dimercaptosuccinic acid, DMSA, and because that does cross the blood-brain barrier and will pull things out. It's a great chelator of mercury, of lead, some other metals too. But as on a non-prescription level, we like to use something called takasumi, which is a bamboo charcoal-like substance that's produced from bamboo in Korea and Japan. And it's more of a general metal and chemical chelator. And what we found happens is, let's say you have a large body burden of metals in your body. If you take something like what's called takasumi, that's the Japanese name for it, it'll grab a lot of the metals. It won't go into your brain, but if you can clear it out of the rest of your body, your brain will take advantage of it and start excreting some of the brain burden down into the body. They want to have almost a homeostasis. So that can be very effective. In some people, we try to increase their metallothionein level, because metallothionein is something that's made inside your body to chelate out metals. And there are certain herbs like burdock and some others that'll help your body make more metallothionein. Then it depends, occasionally we use something like alpha lipoic acid. We might use glutathione. But again, those are the minimum. Usually we're relying on takasumi and metallothionein producing herbs, and occasionally referring out for DMSA. Also, sweating is a great way to excrete copper. We used to send sweat samples out to labs after we had people in the sauna to see what metals were optimally excreted. I mean, copper was excreted very well. Mercury, not as much. We also found, we used to have I'm not sure what you call it, but it's kind of like a bicycle for the arms. It's an upper body cycle in the office. And we found, this was just a clinical observation, but if you were doing it just to exercise your extensor muscles, you're kind of pushing out and then you were pushing out, that it tended to increase metal excretion. There was some connection with whatever neurological pathways were lit up from that and increasing metal excretion. So sometimes we would do some things like that.
What do you think the mechanism behind specifically extensor muscle activation is for?
I'm much more of a clinical observer than someone that come up with a good maybe some of the other people would know that more. This, in the beginning, what happened was we had some MS patients, and when we put them on upper body cycles, it exacerbated all of their symptoms. And when we did some measurements, they were excreting a lot more metals than they had at their baseline. And as they were traveling through the body, it was just giving them a temporary exacerbation. But it can be used therapeutically if you do it at the right level. You could overdo it in some of these folks.
Okay, that's very interesting. And then you mentioned MS as being maybe one of the clinical manifestations of possibly having these toxic metals. What are some other maybe chronic manifestations that you see in your office, especially neurologically related?
It's a little bit hard because we check for so many different things, and no one is just toxic metals. The person might at the same time have a fungal dysbiosis or some type of virus, or their hormones might be off, or they might be sensitive to alpha-solanine or albumin from egg. So our goal is, if we can take care of the majority of those things, and we tend to do it simultaneously. We don't kind of do one and then move on to another. That what we call their total load is decreased enough that there's very quick symptom improvement. But we can't, if I were to examine you, I might find 20 different things. And what I tell a patient is, I really don't know if your symptoms, if each one of those 20 is, attributing 5%, or if there's one particular thing in there that's 60%, but I'm just going to deal with them all, because then the chances of improving are much better.
Right. And you mentioned that earlier, that some people are just better excretors than others. In addition to, maybe giving binding agents or these chelating agents, right? How do you support the body in allowing it to be a better excretor? What are some ways to do that?
Usually exercise, sauna. But again, a lot of times, if you have something like hypercoagulation, you're not going to be a great excretor. One thing that's really interesting is, and again, this is one of those things I can't academically explain, but there's definitely a relationship between electromagnetic radiation and toxic metals. And I think the reason is because a lot of the metals are great conductors. And so we found that certain people who have a body burden of toxic metals and are more on the sensitive side, they're much more sensitive to electromagnetic radiation. They don't do well around cell phones or computers or fluorescence or so forth. And that can even occasionally, this is pretty weird, but in some people, even if they're wearing a lot of metal jewelry, that can interfere with excretion. So a lot of times we'll have people remove that. It doesn't happen so often, but occasionally it could be one factor that we've missed that can be very helpful.
Interesting.
And then we increase their cruciferous vegetable intake. There's a relationship where Brussels sprouts actually can help metal excretion. I know other people use cilantro, and that can be helpful to a degree too. There are different things. The sulfhydryl groups in certain foods it's the same chemicals that they use in some of the stronger prescription chelators. Definitely not as much, but it can help in the whole process.
Yeah. So Brussels sprouts and cilantro, maybe not the best in combination taste wise, but yeah, upregulating.
And I think one thing about metals that probably one of the main symptoms is brain fog. But again, brain fog can be due to foods, can be due to dysbiosis. There's a lot of things that can contribute to it. So again, we just try to cover all the bases.
Right. You had mentioned earlier also that a test that you look at in office is, I think you said, the Romberg test for copper tends to show up?
No, for any metal.
For any metal, okay. So that test is typically a non-discriminate vestibular cerebellar based test. So would you say that the cerebellum is one of the most, I guess, susceptible parts of the brain. Are there other parts of the brain that you notice
You know,
manifest more?
with that test, you can get some, I mean, almost everybody that has a toxic metal burden will fail the test unless they do a lot of yoga or other balancing
Mm-hmm.
exercise. That sometimes can override it. But there are people who fail a test that, it's not due to toxic metals for sure. But, but again, if you have toxic metals, you probably will fail the test.
Mm-hmm.
And if you don't do any, and I'm, in our office, we don't do a lot of neurologic retraining, but
Mm-hmm.
if you don't do the retraining, even if you've chelated out the metals, you usually continue to fail the test.
Mm-hmm. Interesting.
So it's short-circuited things. With metals, the hard thing when they go into the brain is they can cause nerve cell death,
Mm-hmm.
or they can just sabotage pathways. And until you've taken them out, it's really hard to discern what's happened. So
Mm-hmm.
I was poisoned from poor amalgam removal,
Mm-hmm.
and I developed all types of symptoms. I became a very angry person. I would start yelling at people all the time. Cognitively, I just wasn't there. I also had a sensation of numbness over half my body. And so what happened is, after successful chelation, personality changed back, cognitive ability came back, but the sensation of numbness, despite being to, great neurologists and chiropractic neurologists and everyone else, had stayed. So
Mm-hmm.
I think there was some permanent damage from it.
Okay. Yeah. And that actually, so with maybe it's great that you had successful chelation and have had more or less near resolution.
Mhm.
Um, but for those who maybe don't get these things addressed, or maybe have chronic low level lifetime levels, correct me if I'm wrong, but is there a correlation between long-term heavy metal toxicity and neurodegenerative disorders like Alzheimer's and dementia?
100%. And treating is interesting because, I mean, there have been people who have been disabled with Alzheimer's,
Mhm.
and we've chelated out metals, and within weeks they've come back to normal. And then
Wow.
there are others that we could do the same treatment and totally fail. And the
Mhm.
same with Parkinson's and MS. Again, it's very hard to predict when you have neurotoxicity. Can it be totally reversed, partially reversed? And I've seen, the whole gamut.
Mhm. And obviously, there are a lot of theories, a lot of contributing factors to neurodegenerative disorders, but this is definitely something to consider, especially you mentioned the amalgam fillings, and I think a lot of people of a certain generation, that's what was offered, right? And I think people of that generation or those generations are now experiencing some of those neurodegenerative disorders,
Right. And then there are the people who overeat sushi,
right?
mercury poisoning from the ahi. There's all kinds of things like
Mhm.
that going on.
Right, right. Um, and then another thing that we need to be aware of, and we kind of alluded to this earlier, but is dysbiosis, right? And
I
how
think
that
the
interplays.
Yeah, I think the important part, like, let's take fungal diseases.
Hmm.
If you have 100 people walking down the street and you randomly were to test them, probably 50 of them would have some type of fungal issue.
Hmm.
Um, all you need to do is live somewhere like Maui, and there's a chance that you're going to, be in a moldy house, or
Hmm.
visit someone's moldy house or church or used clothing store, or even when we lived in Western Colorado, which was basically desert, people have had water leaks in their house,
Hmm.
or people have done things like taken large dosages of antibiotics and wiped out a lot of the competing organisms. So then the funguses in their body will grow. And
Hmm.
what's interesting is funguses it's almost like having Monsanto live in your gut. So funguses can produce acetaldehyde, it can produce benzene, and all of those are basically toxic to the brain.
Hmm.
So they can get carried there and produce all types of neurologic degenerative changes and symptoms and so forth. If you don't have to chelate out the toxins. Well, sometimes you do. A lot of times the body will spontaneously do that if you get rid of the organism. If you don't get rid of the organism, no matter how many binders and everything else,
Hmm.
you still have that chemical producing microbe factory in your body.
Hmm.
It can live in your sinuses as well as in your gut. So, again, the pathways from the sinuses into the brain are pretty straightforward.
Yeah. Yeah. And fungus infections can be very invasive and pervasive. So,
And we actually found that they're very easy to treat.
mhm.
I mean, a lot of practitioners will say, oh, they're going to take, months and months and months. And we found that that's not true as long as you look at certain things.
Mhm.
One thing you have to look at is, beside treating the person and treating them with the right antifungal, and there's probably 10 different herbal ones we use in our practice, depending on the person. But beside that, if they're in a sexual relationship with someone who has the same fungal issue, which is somewhat likely, they can keep reinfecting themselves.
Mhm.
So, you might have to actually treat their sexual partner at the same time, and their sexual partner might be asymptomatic because
Mhm.
they have better detox pathways or more intact detox pathways. So, that can be important. Sometimes I've had patients where they even got it from their pet because they like their pet licking their face.
Mhm.
Moldy houses is probably the biggest contributor. So a lot of times we'll do tests on air samples from the patient's house, because if it's in their house, unless you get rid of it, and you could use things like ozonation, sometimes you can use essential oil diffusion, but if they keep breathing it in all the time, you're just not going to get them over it, so the symptoms won't clear. And probably the most common symptoms from fungal problems are brain fog, fatigue, and mood changes.
Mhm. So they can
Because
mimic heavy metals, really.
yeah,
Or so it's another very similar. Yeah.
weight gain is very common from a sweets craving, but again, it can be anything. I mean,
Mhm.
sometimes I've cleared a fungus and the person will come back and say, hey, I never was able to grow a beard and now I can. Something that, there's an old saying that anything can cause anything,
Mhm.
which can be very true. Women with problems with their menstrual cycles, a lot of times that's due to the liver not degrading hormones quick enough. But one of the things that really keeps the liver busy is dealing with fungal toxins. So the liver is not going to optimally deal with all the other environmental contaminants if it has a fungus to deal with at the same time.
Mhm. So how might your kind of step-by-step treatment approach be? Once you've identified that you think this is a fungal infection, what's the next step for you?
Well, I think it's very important. Again, like if you go to a lot of doctors and say they determine you had a fungus, they'll put you on an antifungal, be it
Mhm.
an herb like neem, or be it a prescription like Sporanox or something like that. And a lot of times, again, the resolution doesn't happen, or it's very slow. But again, if we take care of all the variables, we make
Mhm.
sure that the partner's clear, we make sure their house is clean, we take them off of things that feed fungus like refined sweetening.
Mhm.
And one thing that people don't, and we take them off of living fungal products. We don't like them to drink kombucha.
Mhm.
We don't like them to take living fungal probiotics like Saccharomyces boulardii or something like that, or a lot of the digestive enzymes on the market. The ones that are labeled vegetable enzymes are usually an aspergillus derivative, which again and the body will have sensitivity reactions to those. But also, if the person's eating foods they're sensitive to, let's say you were sensitive to corn and didn't know it, and let's say twice a day you have some corn derivative,
Mhm.
every time you do, your body's going to make pro-inflammatory um, chemicals, and prostaglandins or leukotrienes or histamine or anything like that. And the body's going to be so distracted with that it's because you need the body also to assist in the process. It's not just the herb or the medicine. Our nervous system has to signal, so you're making the right interleukins and different complement factors and other things. And if it's tied up with some food inflammatory reaction, it's not going to be able to do the rest of it efficiently. You're going to distract it. So we always remove we check the people for anywhere between 20 and 200 different foods. Again, we'll use applied kinesiology, and we'll remove them from their diet during the process. And typically, if we've taken all of those things into account, we can get rid of the fungal dysbiosis in a matter of weeks instead of months or years or never.
That's fantastic. And if somebody was listening to this podcast now or watching this podcast now, and they think they are experiencing some of the things that you've discussed today, how might they get in touch with you and your clinic to potentially seek care?
I mean, what we usually do, since we live in Hawaii, but we do get patients that fly, and we've been training people, since 1987. Though the methods have changed and gotten better, and the diagnostic technique has gotten better. So if people were to go on my website, actually, I think michaellebowitzdc.com, and it has my email address, and shoot me an email, and they tell me where they live. Hopefully, they'll be someone we can refer to.
Mm-hmm.
If not, there are some people who do some Zoom consultations and so forth. I don't think it's quite as good as an in-person evaluation, but depending on where they live, that might be the best that they can do.
Sure. Okay. So michaellebowitzdc.com, spelled just like you'll see it in the title here. Well, we are just about out of time, but I wanted to make sure that we had at least enough time for you to summarize what we talked about today and maybe any final thoughts you have for the audience.
I mean, I think that the combination of doing this type of work, which I don't really have a name for, it's almost, an environmental, toxicological, microbial type of approach, in combination with, really good neurologic rehabilitation, they complement each other, and you get like an exponentially higher success rate in the really complex people.
Mm-hmm.
So I think they just fit together. Having a good team to look at these things and not neglecting any factors can be really helpful. And we've seen lots of people respond very quickly to all kinds of things that they couldn't be helped before.
Mm-hmm. No, exactly. Yeah, you've helped so many people, and I think just by coming on today, you helped that many more by maybe giving some answers and some hope and some direction. So I want to thank you for coming on today. I appreciate you taking time to speak with me and our audience. I really appreciate it.
Well, thank you so much. It's been fun.
All right. And this has been your host from the Neuro Wellness Podcast. Be well.